Study Session 10, Correctional Treatment for Juveniles. Introduction. Nearly all juvenile institutions implement some form of treatment programs, such as counseling, vocational and educational training, recreational programs, and religious counseling. However, this study session will look into some treatment approaches that aim to rehabilitate offenders. These include individual treatment techniques, group treatment techniques, educational, vocational, and recreational programs, and juvenile aftercare. Learning outcomes. When you have studied this session, you should be able to 1. Present at least 3 treatment approaches for juvenile rehabilitation. 1. Individual treatment techniques. These include individual counseling, psychotherapy, and behavior modification. A. In individual counseling, counselors help juveniles understand and solve their current adjustment problems. Individual counseling is one of the most common treatment approaches, and virtually all juvenile institutions use it to some extent. This is not surprising, as psychological problems such as depression are prevalent in juvenile institutions. Sass and Jaff, 1985 to 1986. The goal of individual counseling is not to change a youth's personality. Rather, it is to help individuals understand and solve their current adjustment problems. B. Psychotherapy. This is a highly structured counseling in which a skilled therapist helps a juvenile solve conflicts and make a more positive adjustment to society. C. Behavior modification. This is a technique for shaping desired behaviors through a system of rewards and punishments. This type of program is easily used in an institutional setting that offers privileges as rewards for behaviors such as work, study, or the development of skills. Behavior modification is effective in controlled settings where a counselor can manipulate the situation, but once the youth is back in the real world, it becomes difficult to use. Klein, 1977, Siegel, Welsh, and Senna, 2003. 2. Group treatment techniques. Group therapy is the counseling that allows several individuals together in a group session. Individuals can obtain support from other group members as they work through similar problems. Group therapy is more economical than individual therapy because one therapist can counsel more than one individual at a time. Also, the support of the group is often valuable to individuals in the group who have survived similar experiences. Siegel, Welsh, and Senna, 2003. One disadvantage of group therapy is that it provides little individual attention. Everyone is different, and some group members may need more individualized treatment. Others may be afraid to speak up in the group and thus fail to receive the benefits of the group experience. There is also the concern that by providing therapy in a group format, those who are more chronically involved in delinquency may negatively affect those who are marginally involved in delinquency. Daishian, McCord, and Pauline, 1999. Today, group counseling often focuses on drug and alcohol issues, self-esteem development, or role model support. In addition, because greater numbers of violent juveniles are entering the system than in years past, group sessions often deal with appropriate expressions of anger and methods for controlling such behavior. Siegel, Welsh, and Senna, 2003. 3. Educational, vocational, and recreational programs. Educational programs are an important part of social development and have therapeutic as well as instructional value. They are an essential part of most treatment programs. Vocational training has long been used as a treatment technique for juveniles. Today, vocational programs in institutions include auto repair, printing, woodworking, mechanical drawing, food service, cosmetology, secretarial training, and data processing. Recreational activity is also an important way to help relieve adolescent aggressions, as evidenced by the many programs that focus on recreation as the primary technique. However, treatment programs that seem to be most effective for rehabilitating juvenile offenders are those that use a combination of techniques, programs that are comprehensive, built on a juvenile's strength, and adopt a socially grounded position, have a much greater chance for success. Successful programs address issues relating to school peers, work, and community. O'Sullivan, Nancy, and Murphy, 2001. Siegel, Welsh, and Senna, 2003. 4. Juvenile aftercare. Aftercare in the juvenile justice system is the equivalent of parole in the adult criminal justice system. Aftercare is a transitional assistance to juveniles, equivalent to adult parole, to help youths adjust to community life. When juveniles are released from an institution, they may be placed in an aftercare program of some kind so that youths who have been institutionalized are not simply returned to the community. Return to the institution for further rehabilitation depends on their actions during the aftercare period. McCord, Wisdom, and Crowell, 2001. Study session summary. In this study session, we examine the correctional treatment for juveniles. These include individual treatment techniques, group treatment techniques, educational, vocational, and recreational programs, and juvenile aftercare. End of study session 10. Thank you for listening.